Hi there, it's Dr. Patricia. How are you? Welcome to this presentation I'll be doing today. And today we're going to be talking about urinary tract infections and the surprising connections between things in your body like the microbiome and the immune system, which maybe is not so surprising, but the relationship between the microbiome, which I'll explain what that is, the immune system, and places like your urinary tract will determine whether or not you get infections in these places, like urinary tract infections, bacterial vaginosis, and candida, those sorts of things. Okay, so super, super important. I'm just going to check and see. I don't know if my comments are working, so I'm going to hop on to Facebook here and check and see if I can see it, any comments that come up. And if you join me live, oh, here we go. Yeah, perfect. If you join me live, please put in your name, where you're joining in from, and because you're joining live, you get an opportunity to ask questions. So please do so. And I'm pretty sure here I can see the comments coming up. If you've joined me live, please put in a comment, just so I can make sure that I can see them. Okay? Okay, perfect. So the urinary tract is, so basically when we speak about the urinary tract, we can include the entire urinary tract, which starts at the level of the kidneys, okay? And the kidneys live in our, like, not in our belly, but just in the back, kind of like the mid-back region, to the point where if you get an infection of the kidneys, you'll get pain in that like lower back region, okay? So that's where the kidneys sit. And the blood is coming through the kidneys and filtering things out through the kidneys. And so that filtering process will create the urine, right? So the kidneys are like a filtration system. The blood comes through it gets squeezed through the filtration system. Certain things make it through into the kidneys. The rest continues into the blood, and you start creating urine. Now the urine is getting collected in the kidneys, and it's draining down through little tubes. So here's the kidneys, little tubes, the ureters. So they're like literally like little tubes, and they empty out into the bladder. Okay, so here's the bladder, and the urine builds up and builds up in the bladder. And after a certain point, the body senses that it's at a certain level of fullness, and and there's a sphincter at the bottom, kind of like a valve that is closed when it's filling up. And when your body's like, okay, it's time for me to pee, it tells your brain, you go to the bathroom and you sit down, and relax the sphincter, and the bladder contracts and you void. Okay, we're going to stick to the topic of infections now. What is really, really interesting is that infections are very common in women, way more common in women than in men. Actually, before the age of 70, like and at certain ages, like the younger ages, especially when we're sexually active, we have infections 50 times more frequently than men. Just crazy. And then around the age of 70, it's 2 times more frequent. So even then, it's like 2 times more frequent, but at some points, it's 50 times more frequent. And I actually get requests from women to speak about urinary tract infections, and not just like the one-time infection, but the infection that keeps happening like over and over again. And some women are like at their wits' end, because what happens when you have an infection? Well, the infection can affect the kidneys, which is then called pyelonephritis. It's a specific name, the upper urinary tract infection. Or it can go into the ureters, into the bladder. That's the one we're more familiar with, and that's a lower urinary tract infection. When you get that kind of pain, that kind of infection, it's characterized by pain, burning, frequent urination, because now that bladder lining is irritated, so it's just like quickly contracting all the time, and so you're peeing a lot, and you can even pee blood. Okay, so you can pee and see blood in your urine. And typically what happens is that most women don't know how to manage that. They don't know how to prevent it, and they don't know how to manage it. So then they go in and get an antibiotic. And sometimes that's necessary, but here's the thing about antibiotics. Antibiotic, when you take it through your mouth, it has to first go through your gut and then be absorbed through your gut into your body, and some of it makes it into your bladder, right? But it's not like there's a label on that antibiotic saying just go to the bladder, please, right? It's literally going everywhere in the body. And what we know is that that has very harmful effects on a part of your body, a very important part of your body called the microbiome. The microbiome is the group of organisms that live on us and within us. So, like in our skin, in our mouth, in our nose, in our lungs, actually, in our gut, in our vagina, and now we know also in our urinary tract, which we thought was sterile, but actually it's not. It has its own community of organisms, and these organisms are microorganisms because you can't see them with the naked eye. And they're things like bacteria and parasites and fungi and even um, um, viruses, all of these things, okay? And then there's three categories of these microorganisms. One is they're commensal. They just live there. They don't affect us. We don't affect them. They're just there. Like they found a home. They're happy and they don't affect us positively or negatively. Then the other group is called symbiotic, where we coexist with them. And in fact, if we didn't have them on us, we would die. Like there are organisms, microorganisms inside of our cells that are actually act like our battery packs, and those are the mitochondria. So mitochondria, which are the battery packs within our cells, are actually ancient bacteria that found their way into like the most primitive cell back then. And they found that when they worked together, they produced so much energy. It was so much more efficient for that cell, and that mitochondria was being given the energy, like the food that the cell was eating was being given to the mitochondria. So the mitochondria got the food that it wanted, and then its poop basically was the energy for the cell. And so that's ATP, which is our energy. And so there's this beautiful symbiotic relationship between the microorganisms that live on us and in us and our human cells. And actually, the research shows that for every one human cell, there's one microorganism. So it's 1-to-1. And if you look at the DNA, if you take all of the DNA of everything that's in us and on us, including human DNA, we're 10% human. Doesn't that blow your mind? Like 10% human. That's just crazy. The rest of it is DNA from all of these other microorganisms. Okay, remember, if you're joining, put your name in and where you're joining from. I'd love to hear from you, okay? So, so why is this relevant? Well, first of all, when you take an antibiotic for a urinary tract infection, the research shows that you are harming the microorganisms inside your gut lining and the tissues that it travels through in order to get to your bladder, okay? And it is recoverable. And sometimes it's actually not 100% recoverable. Like some of the damage that is done is permanent. And the thing is, it's recoverable if you're intentional. So when we speak about using probiotics, which a probiotic is a capsule that has these microorganisms in it, and you take it, so you're kind of like reintroducing the microorganisms into your body. There's research to show that when you take an antibiotic, you should take a probiotic separated by at least an hour from taking the antibiotic. Then you take the probiotic, and you should do that while you're taking the antibiotic and for about 3 months after at least. Okay. So if you get to a point where your urinary tract infection is so severe that you just need to get an antibiotic, because if you don't treat it, if you don't do something about it, and if you don't know these techniques that I'm going to teach you, and you don't treat it, then that infection can actually spread up into the kidneys. And then that's very bad, because the kidneys are very, very fragile tissue. And you don't want to affect the tissue of your kidneys, because that can lead to scarring of the kidneys, and that can lead to problems with kidney function, which, as you know, is not a good thing. Okay, so let me just adjust my seating here so I'm a little bit more comfortable. I'm sitting in this position for too long already today. So then you say, okay, Dr. Patricia, now you told me what the problem with taking antibiotics is, and that if I have to take it, I should. And then if I take it, I should take antibiotics, as you described. But how do I prevent urinary tract infections from happening? I said, that's a good question. I'm going to teach you how. So there's different kinds of infections, okay? One kind of urinary tract infection cause has to do with being in that sexually active period, where when you're having intercourse with a partner and they introduce something into your vagina, it could be a penis, it could be a sex toy, it could be something else, that can introduce like a foreign microbiome into that vaginal area, okay? And the mechanical pressure can actually cause bacteria from your things like your colon. So from your gut, we have a microbiome in the gut as well, especially around the anus area. That can actually cause, the friction can cause the microbiome from there to go into the ureter, which is a passageway from the bladder, so you go into the ureter, into the bladder, and they can travel up. And so the most common infection in younger women is E. coli, which is what you find in the gut. And so literally the pressure is causing that infection to go up into the bladder. And so one really good tip is right after intercourse of any kind, you go to the bathroom and you sit down and you have a pee, and that'll help just flush out that urine that has potentially been infected. And so that'll just help that out. Okay, so that's really important to know. So that's one way to cut down your risk of infections. And interestingly, ideally you would pick a partner that's in good health, because if they have unhealthy microbiome on their skin, there is, for example, a penile microbiome, and they're introducing it into you, and they are not healthy, that can actually cause a change in the microbiome in your vagina. And your vagina microbiome has its own unique community of microbiomes, which is different from the gut microbiome. And research has shown that the vagina microbiome, when it's affected, affects the urinary tract system, okay, which is very, very interesting. So some people have problems with urinary tract infections, some with bacterial vaginosis, some with candida. And now I'm going to take it back to a full scope picture to teach you why these are all related on some level and what you can do about it, okay? So recent research shows that the urinary tract has its own microbiome, okay, its own unique community, and that the health of the microbiome of the gut, the urinary tract, and the vagina all are related. So if you have an unhealthy gut microbiome, it can create an unhealthy vaginal microbiome, which can create an unhealthy urinary tract microbiome. So for example, in the case of the antibiotic for that infection, and let's say it does create an unhealthy gut microbiome, then you could have an unhealthy vaginal urinary tract microbiome. And that's when you can get into the loop of chronic urinary tract infections. Do you see that? Let me know if you don't. Definitely give me feedback if you don't. And I see there's one comment here. Let me just see the comments. Okay. Oh, for some reason I can't see the comments, but please do put in. Oh, good morning, Ursula from Canmore. Wonderful. Looks like the comments are working now. So that's really great. Okay. Okay. So here's the thing. If we know that, and what's the connection between the microbiome and the immune system? Well, the immune system is the part of your body that will fight off the infection. So you need a really robust and healthy microbiome, and you need a really robust and healthy immune system. The microbiome, you need it to be robust and healthy, because if the microbiome is weak, it will allow other organisms to flourish. So if you have a decrease in your symbiotic or commensal organisms, those are the ones that either occupy space and don't harm you, or occupy space and help you. If those levels go down for things like, and here's what, for certain things, which I'll tell you about in a second, that will create space for the bad guys to move in. And then the bad guys will take over, and that's when you get your chronic urinary tract infections that keep cycling through your body, or your bacterial vaginosis, your candida. They will live there, and they will pulse up and down depending on things like your hormones. Some people, for example, will find that they get candida infections depending on the time of month. Other people will find that their infections get worse with stress, which is the cortisol hormone effect, right? So very important in that way. And then you say, okay, well, how do I keep my microbiome healthy? Okay, so here's an important thing. In the vagina, to keep so there's local things you can do at the level of the vagina and the urinary tracts. And then there's the things you can do to keep your gut microbiome healthy, so that communication is good and they both work well together. So first I'm going to focus on the vaginal microbiome. So if you're putting things in there, you should probably be aware of what they are. So for example, if you're putting in tampons, I highly recommend using organic cotton, because there are chemicals in the other kinds of tampons that will disrupt your microbiome. Okay, and that's just a fact. So I would definitely purchase the organic cotton tampons if that's what you're using. Okay. If you're putting anything up there like the cup and that kind of stuff, you want to make sure it's sterile. You want to make sure it's really well cleaned. But if you put alcohol in it to clean it, for example, you need it to completely dry out, because if you put like that, let's say you use alcohol or something like that to clean your cup, and then you put it in while it's still wet, that's going to kill off your microbiome too, and that's not a good thing. Okay, so that's another thing. And douches and stuff like that, I know they're not very popular anymore, but definitely don't use those. That definitely disrupts the microbiome in your vagina and can make you more susceptible to having urinary tract infections. And for example, if you love to do a soak in a tub, avoid putting in things with chemicals like bath bombs. Those bath bombs, sometimes they have chemicals in them, and that can get up into your vaginal area, and that can disrupt your microbiome, and that can lead to things like the bacterial vaginosis, fungus, and urinary tract infections. Okay. So just those are examples, but if you're introducing anything into that area, including tampons, all those sorts of things, definitely keep in mind that can cause an issue with microbiome. The other thing that can cause an issue with the microbiome there are things like IUDs. So like the IUD Mirena and the IUD copper, we don't fully understand what the effect of those things are yet on our microbiome. So it could be positive, it could be negative, it could be null, like no issue. But the reality is that we don't know. Okay, so just to keep in mind, I've had an IUD in the past, and I definitely understand there's a reason why I got it, and I realized afterwards it was a band-aid solution for an underlying real issue. And now I know that I simply will not use those things anymore. Okay, but that's another story. The other thing is, now we're talking about the gut microbiome. I'm telling you for sure, if you have a disrupted gut microbiome, you're putting other parts of your body at risk for diseases. Things that have been proven to be linked with a disrupted gut microbiome include what's called cardiometabolic diseases like heart attacks, high blood pressure, stroke, high cholesterol, those sorts of things. Being overweight, obesity, or even just being overweight around the belly, inflammation from the gut microbiome causes the belly to become inflamed and become prominent. So that prominent belly can be due from that. And then autism, interestingly enough, is being deeply studied. And I'll think about the other ones. There's like Alzheimer's and Parkinson's and ALS and those kinds of what we call neurodegenerative diseases and dementia. Okay, so clearly gut microbiome is so healthy. It's so important. And so how do you keep the gut microbiome healthy? Well, it's through diet, so not eating processed foods, okay, because the processed foods have additives and chemicals that do kill off our microbiome. It's avoiding antibiotics as much as you can. It's stress levels. Brain gut connection is for real, and stress can cause the gut to become leaky, increase intestinal permeability, and that disrupts the microbiome severely and actually lets the microbiome get into you, which is very bad for inflammation. And other medications like proton pump inhibitors for reflux can actually seriously affect the microbiome if taken for the wrong reasons and for too long of a time. And I have to say, I've been seeing a rash of prescriptions for this kind of drugs, even in babies, and I think that's going to lead to a lot of health issues. There's a reason babies are getting reflux. We need to figure it out. What's the reason versus give them a prescription that will affect their microbiome and potentially cause long-term harm. Okay, so I'm just putting it out there. All right. So there's many other reasons, but this is something that you want to deeply look into is gut microbiome health. Okay. And it's a core of my teachings and my programs for that reason. And then you're like, okay, well, I'm doing all the things, but I'm still getting this urinary tract infection. What do I do? And one question I had from a member of Wild Wisdom was, what about the drug Eurista, which the main component is phenazopyridine? So I looked it up, and it's not available in Canada. It's available in the US. And can you believe it? The main active ingredient it's a dye. It's actually a dye, so it's a chemical that has been shown to basically hurt the nerve endings in your bladder, so they can't sense pain anymore. So it doesn't do anything to fix the underlying root cause, which I've explained to you. And it damages, and you take it in your mouth, so it gets through your whole body before it gets to your bladder. So imagine the damage that it's causing. I mean, it just blows my mind. So personally, I would not use those kinds of drugs. And of course, going on low-grade chronic antibiotics, I've already explained to you, is not the solution either. So you have to look at the root cause. You have to fix the microbiome within and throughout. And if you do get an infection, here's what you need to do. First of all, you need to hydrate. You need to have at least 2.5 liters of water a day. Usually it's 2.5 liters, but with a urinary tract infection, you got to bump it up. And it should be mineralized. You should have a little bit of good quality sea salt added to that, like a pinch, just to make it a bit mineralized. Not so much that it's salty, and not table salt, for not sodium chloride, but real sea salt, Himalayan salt, rock salt, Celtic salt, just natural salts, which have about 82 minerals. You mix it in there, and about half a teaspoon for every 8 ounces of water or less. If you find it's too salty for you, like a quarter teaspoon, 2.5 liters or more a day. Chug it back. Okay, you gotta drain out those organisms. Now you gotta increase your immune response. So vitamin C is crucial for the immune system to work. And I would take 2 grams of vitamin C a day at least during an infection. So 1 gram twice a day. Yeah, Ushi's saying the gut microbiome seems to be at the center of everything. Wow, absolutely. Hippocrates says disease begins and ends in the gut, right? All disease begins in the gut, and I totally agree with that. The more I learn, the more I know, the more I realize I agree with that. So you have to be on vitamin C, and you can do like a natural source of vitamin C, like amla berry powder. Okay, you can buy that at health food stores. Or you can do like a sodium ascorbate or magnesium ascorbate. You can go into the guide section of the Wild Wisdom for Women's with Dr. Patricia Mills Facebook group. And you can go there and see that I have put a list of my favorite vitamin C's that you can buy through online, for example, but you can take those and go to your local health food store and ask them if they have those products. And I look very carefully at non-medicinal ingredients. Certain things like Emergen-C, I'm not a big fan for various reasons. So I highly recommend you looking at these specific products because they have the cleanest amounts of ingredients, the least amounts of non-medicinal ingredients that can be harmful, and the more what we call bioactive form that actually gets into your tissues, like the liposomal vitamin C. I would definitely recommend liposomal vitamin C while you have an active infection, or the key is to start it as soon as you get the inkling that something is going on. That's when you get the biggest bang for your buck, but you can start it at any point in time. And then you can do other things like, so if you're doing your vitamin C, 2 grams or even more for a period of time while you're infected, you're doing your hydration. Cranberry juice has received a lot of attention, but the key is it can't have sugar in it, right? It can't have added sugar in it. Cranberry is very like sour. So anything that is sweet when you're drinking cranberry has a lot of sugar. And guess what? Those organisms that are causing you the infection love sugar. So you got to go sugar-free diet for that period of time. And you have to have an unsweetened cranberry juice. Or you can buy what's called D-mannose, D-MANNOSE, which is one of the ingredients isolated in things like cranberries. And the way it works, which is interesting, is that because the bacteria like to stick to it, they like to hold on to it, the D-mannose, for whatever reason. So they kind of stick to it, and then you're flushing your system with urine and you pee it out. So sticking, pee it out. So you take the D-mannose and elderberry as well. Lots of really good vitamin C in there. Again, you don't want to have it with sugar. You want to have it as like a tincture or something like that. Okay. I get dried elderberries and I steep them in hot water and I have it as a tea, and that's a really great way. And remember, mineralize that tea as well. And something else that has gotten some good research is what's called uva ursi tea. Okay, and that seems to also help decrease that infection in the bladder. Now, remember I told you about the microbiome, and that what happens with the infection in the urinary tract is that either you get an introduction of an overwhelming, remember there's a commensal, which are in us but don't harm us, the symbiotic, which are in us and help us, and the pathogenic, which are in us and harm us. And usually you want like 85% of the good guys and 15% of the bad guys is okay. But when you have, for example, intercourse that introduces a bad guy in high amounts, or as you age, the microbiome quality goes down, or let's say you took the antibiotics or you did the poor diet or whatever, and the microbiome is affected, and now those commensal and symbiotic go down, and then that allows a pathogenic to take over. It's like gangs of New York, when one goes down, the other one takes over. So a probiotic that has been shown to have the strains that are present in most healthy women without urinary tract infections, and that has been shown to be down in women with urinary tract infections, is lactobacillus. Okay, So what you want to do is buy a probiotic that has a lactobacillus blend. I would try to buy ones that don't have dairy in it, just in case. A lot of organisms love to eat dairy, and so we don't want to necessarily overfeed them during this time, especially. Okay. So I would get a lactobacillus blend, and I would take that religiously, and I would continue to take that for at least 3 months after that infection. And if you have chronic UTIs, I would be, instead of taking a chronic antibiotic, for example, which most doctors don't even recommend, by the way, they often prescribe that as like, I just don't know how to help you, so I'm going to do this even though I know this is not good for you. Okay, that's what's going on in their minds. Okay. I've been involved with people with chronic urinary tract infections, with people with spinal cord injury. They're very, very susceptible to these infections. And it's with great reluctance that doctors will prescribe such a medication. And there's even debate of if it's helpful or not. Anyways, what I would do if I had chronic UTIs is I would problem solve fixing my microbiome like it was my biggest priority. I would hydrate every day very well. I would have at least 2 grams a day of vitamin C. Okay, that's the recommended daily, like that's the maximum recommended daily allowance. So you're safe, 1 gram in the morning, 1 gram in the afternoon. I would consider investing in the liposomal form at least once a day. I would make that liposomal vitamin C, which has better absorption into the body due to the way that it's made. And I would drink teas like elderberry teas and cranberry teas and that kind of stuff. Just, not every day, but I would do it interchangeably. And I would take a probiotic every day. I would take the lactobacillus probiotic every day. Okay. So, and interestingly, I'm just going to throw this in there. I do follow the works of like a Dr. George Peterson in the US, who is working with the US Army. And you're going to be like, what does this have to do with urinary tract infections? But silver is a really amazing antibacterial agent. And he developed this new pH neutral silver, which means that it's not too acidic or too alkaline. So you can put it on membranous tissues, like in your mouth and in your vagina. And I was watching him present once this results of his research, and he recommended that for women who have vaginal infections, you can take a tampon, again, the organic cotton tampon, and you can coat it in his silver. And the product is called Thank You Silver. So if you go online and you put in thankyousilver.com, and you go into like the purchasing for the patients or population, there's like a website for the doctors, but there's a website for people who can just order online. That's one I order. And you buy the gel, or and what you do is you coat the tampon in this gel, and you put it into your vagina, and you use it until the infection clears up. And that's relevant for bacterial vaginosis and fungal infections as well. Okay. Now there's no specific research that shows that this specifically helps with this condition. But if you're trying to throw everything, like you're just using every tool in the toolbox, I have actually tried that with once I got a fungal infection, and it helped. Like definitely it went away without me having to buy medication for it. But I also went on a very low sugar diet because sugar also feeds candida. And I hydrated like crazy, and I did my probiotics. I did all the things. I did my vitamin C. It's not one thing. If you think it's going to be one thing that's going to give you the results that you want, that's not the way that whole health works. Not the way that true health works. It's not going to be one prescription. It's not going to be one thing. It's going to be a holistic approach with many different things. And there's the things that you do in the moment, and then there's the things that you do every day of your life. And when those two come together, okay, like the ocean and the waves, there's the ocean, which is everything that you always do. And then the waves are the things that you do as things come up that you add on to it. That's when you're going to get your whole health starting to develop. Okay. So if you have any questions, I'll give it just a minute because I noticed that there's a little bit of a delay, about a 30-second delay. So I'm going to let you ask some questions. So I hope that you found this helpful. Please share this video with anybody in your life who's getting urinary tract infections that are chronic, because they're terrible. And here's another thing. One way you could have a urinary tract infection is if you're voiding frequently. If you're like constantly going pee, okay, and the doctor will say like you're waking up often at night and you're just frequently going pee through the day, it can be, they call it an overactive bladder. If they use the regular ways to detect urinary tract infections, they only actually screen for a few organisms. They don't screen for like all possible organisms. So you may not have like a massive amount of the bad guys, so that's what they detect on the screening, but you might have too low of the good guys. Do you see what I'm saying? And that affects the lining of the bladder, because the lining of the bladder is dependent on the presence of these good guys, because they help create the mucus that surrounds the lining of the bladder and the vagina. And so when you have not enough of the good guys, you get things like bladder overactivity, you get vaginal atrophy, vaginal lichen sclerosis, vaginal dryness and pain, right? Because these organisms also respond to your hormone balance. So you can see how this is all starting to come together and make sense, right? And Ushi liked the analogy with the ocean and the waves. Thank you. Just came up with that. I like analogies. You know, it just is so helpful to paint a mental picture sometimes. So I appreciate that you like that too. So ladies, thank you so much. Ushi, thank you so much for joining me. A big shout out to Ushi. She's such a amazing participant. I love it when you show up. You ask great questions. You participate so well. I so appreciate that. It makes it fun for me. I so look forward to having people like you join the feed. So thank you. And I hope you all have a wonderful rest of your day, evening, or night, depending on when you catch this replay. Bye.